with mindful eating. I'm really glad you're here. Thank you for coming. Have any of you come to mindful eating programs here before? Well, let me see if I can see you. No, I see Barbara shaking her head no. Lisa says no. Is anybody, well, how about you just raise your hand if you have been here before? Because I've done a couple of, let's see. Somebody says yep, somebody says no, somebody says first time. Okay, good. Well, I just want to tell you a little bit about what this is about. My profession for many years was as a registered dietitian. I did hospital work and I did all kinds of instruction on all kinds of diets. I knew them all. And I learned that there's no shortage of information about what's good, healthy food to eat, but there was an important piece of the picture that was missing, and that is how we eat. And so that's what mindful eating is all about. So let me start my slide presentation. I'm going to be going back and forth between seeing you and doing my slide presentation, because I'm going to be asking you some questions and asking for some input as we go along. So let me get my PowerPoint up here. There we go. Okay, so let's start the new year right with mindful eating. One of the things I want to make sure you know is that mindful eating is very different from dieting. It's about how we eat more so than about what we eat. And my intention is to let you know just what is involved in eating mindfully. It's something anybody can do, anytime, any place, and it's simple, but not always easy. Before I go on, I just want to ask, did you get the message to bring a snack? We're going to be doing an eating practice. So if you have a little snack of some kind that you can just take a bite or two of, I'll give you a couple of minutes to just go and run and get something. I think most of you are at home, right? So let's, I'll just chit chat a little bit about why I'm here and what I've, what my credentials are. As I told you, I'm a registered dietitian with over 30 years of experience doing nutrition education. And I've worked in many different hospitals, and I've done work at the cardiac rehab at the hospital I used to work at. I've done outpatient work. I was a certified diabetes educator for many years. I've gotten a lot of experience. And one of the things that I learned, I've always done yoga, and with yoga comes meditation and paying attention to how our bodies are. And at one point, I found that there was a new program being offered about 12 or 15 years ago about mindful eating, and it was at a discounted rate for dietitians. So I was able to go there and learn so much about what mindful eating is. And the other thing I did at the same time is that I was able to take a course called Mindfulness-Based Stress Reduction, which goes together beautifully. Has anybody heard of Mindfulness-Based Stress Reduction? It's actually a very popular program teaching people about mindfulness in general. Let's see, I'm checking our chat here. And teaching people about mindfulness in general, and also teaching people a very simple secular form of meditation. I'm not trying to convert anybody to any particular religion. I'm just telling you about what mindfulness practice is, which has nothing to do with religion. And actually, mindfulness and meditation are part of almost all religious and cultural traditions. So that being said, has everybody got something to eat now? Okay, so moving right along with the slide presentation, if I can figure out how to advance it. Sarah, help me. Oh, there it is. Did you start the year with any resolutions or intentions? Just a rhetorical question. I know that many people start their year with questions, with resolutions and intentions. What does that mean? For me, setting an intention or setting a resolution means I'm setting some goals for myself for what I want to happen or to change or to stop happening in the new year. That's what it means to me. And am I right in assuming that? I mean, I can see some faces. Actually, I can scroll down and see some. Oh, there's a lot of people who don't have their faces up here, but that's okay. Whoa, somebody's got a bear at the picnic table. um, anyway, I can see names. I can see a few faces. Is there anything in the chat? Okay. Well, anyway, just the question being, if you have set resolutions for yourself, think about what they are. And this is, okay, let me move this. Sarah, oh, there it is. So here is a diagram of the categories that many people put on their resolutions and intentions list. I really think that we all need to, I mean, this is my personal opinion, but that we all need to be paying attention to personally caring for ourselves. Intelligent self-care is on a lot of people's resolutions list. Am I right about that? You know, we want to take care of ourselves. We want to eat more healthfully. We want to make sure that we exercise, and we want to make sure we manage our stress well, right? Okay, well, that's where I start with, and that's why that's the big compartment on the screen. Managing stress. Does anybody here have their stress really under control? If you are, I'll say congratulations, but you know what? I do this because I need to manage my stress too. So managing stress can help us in all areas. And that's that's the foundation of what we're going to be talking about today. If we are taking care of ourselves and managing our stress, we're much more likely to engage in healthful practices, such as exercise. If you're really stressed out and really hyper and wound up and feeling terrible, you're not quite as likely to do the exercise that you know how to do and that you know you should do, and also to eat healthfully. If you're really stressed out, what are you going for? Are you going for a salad or a carrot or a piece of fruit? Not likely. You're probably going to go for something that would be in the, quote, not so good for you category. Am I right? I wish I could see you, but I can make an educated guess that you're nodding your heads or smiling or something. Am I right? Okay, so I'm going to talk to you about what mindfulness is. Have you heard of mindfulness? Has anybody heard of mindfulness? I see one head going up and down. Mindfulness is all over the media now, but I think that that's a good thing, because that means that people are really interested in doing something about how mindful they are. This is the key definition that I learned in my training of what mindfulness is. It's very simple, but again, not always easy. Mindfulness is paying attention on purpose to what's going on inside of us and around us without judgment or criticism. And let me just point out and ask you to think about what your attentiveness level is. When you're doing something, are you giving it your undivided attention or not? Okay, when I was in college years and years ago, I remember my instructors saying, we've learned about this wonderful new thing. It's called multitasking. Have you heard about multitasking? When you can do, you know, that you can do all kinds of different things at one time and you can get so much more done. And wow, isn't this wonderful? Well, we are now learning, I don't know if you knew this, we are now learning that multitasking is really not all it was cracked up to be. And we're learning they're actually, I love to read research studies. I just like science and reading, you know, the core of where information comes from. They're doing scientific studies that are absolutely proving that when we're doing one thing and one thing alone, we are much more efficient. than if we're doing several or many things at one time. When you give your undivided attention to what you're doing, you reduce your stress level because you're not distractedly looking from one thing to another, but you also are more efficient and you make fewer mistakes. So mindfulness is about paying attention to what we're doing here and now, being in the present moment in all the things you're doing. So mindfulness of the body is where mindful eating fits in. And I'll ask you now to notice how you are. Are you hungry? If you're hungry, how do you know you're hungry? Did you ever think about how you know you're hungry? Where does hunger reside in your body? Do you feel it in your stomach? Do you feel kind of foggy in the head when you're hungry? Do you feel nervous or agitated? Just think about how hunger shows up for you. So right now, are you hungry? Are you tired? And if you're tired, how do you know you're tired? Are you feeling tense? When you feel tense, what do you do about it? Do you just sit with it, or do you do something to relieve it? You know, take a couple of deep breaths, go for a walk, you know, change your activities or your position. Are you bored? Are you bored with what I'm talking to you about? That's okay. You know, I'll see if I can make it interesting for you as we go along. Or are you really excited to be talking about mindful eating? So noticing how you are right now is a practice that is part of mindfulness. Just paying attention to what's happening inside you. Okay. Recognizing hunger, I mentioned, it can reside in many different places in our bodies. Your personal likes, dislikes, and habits are things that you've learned through the course of your lives and through the media and through the things you've maybe taken courses about. But let's talk about self-imposed diet restrictions. Has anybody in this group ever put themselves on a diet? Silly question. Everybody in this country has put themselves on diets, right? But there's lots of diets out there, many diets. And I think I mentioned this before, but I'm going to remind you of this. There are many diets. When I first became a dietitian, I thought, oh, this would be a really good practice for me to find out all the diets that there are, so I can become an expert on every diet, and I'll be able to teach everybody all the things they need to know about diets. It's overwhelming. There's just so many diets out there. The reason there's so many diets out there, in case you were wondering, is that there's lots of different things that work. You know, we all look different. We all have different bodies. We all have different personalities and different histories. And there's many different ways of eating that are healthful and enjoyable. And there's no one size fits all, because no two people are exactly alike. So just think about the diet restrictions you've imposed on yourself for the purposes of health or the purposes of weight management, and thinking about what your personal goals. Of course, we have to include allergies and intolerances. I'm not going to get into that today, but just keep in mind, if you have allergies and intolerances and people tell you you should eat something and you know that you've got an allergy to it, well, you know, that's not good advice for you. But you think about what your goals are. You know, if you're here because you want to take better care of yourself, to manage your stress in a better way, to be healthier or more physically fit, or maybe you want to look better. They're all fine goals, and I'm not going to comment on any of them. They're fine. But sometimes in our culture, we're a little too focused on being a certain weight number or a certain size number that may not suit our bodies. And so I have to be compassionate to you and to the other people I talk to about, well, what are your personal goals, your weight goals, your fitness goals? We have to make it fit for you. And that's where mindfulness of who you are and what your body is makes a big difference. So we are going to do a practice, if you're okay with that, called a breathing exercise. It's only I'm gonna time myself and make sure I don't let it take any more than 3 minutes. This is a mindfulness practice. I wish I could see your faces. I see something in the chat. Let's see what I need to look at. Your dog is begging for your snack. I think that's an old one. Yes, people with diabetes are always on diets, but you know, if you know what works for you and what doesn't work for you and the things that have to be limited, yes, I get it. I was a diabetes educator for a long time. Yes, so you have to pay attention to your eating when you have diabetes, and some of the people with diabetes are really knowledgeable about what works for them and what doesn't work. So anyway, now we're going to do a breathing exercise practice, and I'd just like to see a show of hands. Has anybody ever done breathing exercises? Does anybody even know what I'm talking about? I see Jessica raised her hand. Okay, that's maybe that's the only person. Well, whether you did or not, whether you've done it or not before, it's okay. I'm going to lead you through it, and it's really simple and really easy. Okay, so just get yourself comfortable. I assume most of you are sitting down. Okay, so get yourself comfortable. No slouching. Just sit up straight. But you don't have to be stiff or uncomfortable. Just make yourself comfortable. Feet flat on the floor helps us just to pay attention to being in a dignified position. Put your hands wherever feels comfortable for you. Sometimes people put their hands flat on their thighs, or sometimes they'll fold their hands in their lap. It doesn't really matter. You know, some people like to have their palms facing up. It doesn't really matter. For what we're doing here, we're paying attention to breathing. Okay, so if you'd like to close your eyes, go ahead and do that. If you want to keep them open, that's okay too. But right now, just sit here and notice your breath. Don't do anything to change it. Just notice your breathing. You are breathing. And ask yourself right now, as you're breathing, what is my experience right here, right now? You're observing your breath and noticing thoughts, feelings, physical sensation. And keep coming back to noticing the breathing. However deep your breathing is, just noticing it. Acknowledge and recognize your experience, even if it's something you don't want. We have to accept sometimes that experiences come that we don't want. And then gently redirect your full attention to your breathing, to each in-breath and to each out-breath as they follow, one breath after another. Your breath can function as an anchor to bring you into the present and to help you tune into a state of awareness and stillness. Breathing again, continuing to breathe. And now expand your awareness around your breathing so that your awareness includes a sense of your entire body, your posture, your facial expression. The body, awareness of your body enhanced by your breathing. This breathing space, taking time to notice your breathing, provides a convenient, easy way of stepping out of that automatic mode and reconnecting with the present moment. The key skill here is to maintain an awareness of your present moment, you in this moment, and nothing else. That's all there is to it. Does anyone, now that we've done a breathing exercise that only took 3 minutes. Does anyone have any comments or any questions about breathing exercise? Any thoughts? Did you like it? Was it hard to do? What do you think? What do you think about it? You could raise your hand and unmute yourself if you want to. Well, I'll just put it out there that the breath is a really valuable, really useful tool for stress management. Have you ever noticed when you're in an intensely emotional or stressful situation that your breathing speeds up? If you just sit or even just stand where you are and take a few deep, quiet breaths, it makes a big difference. It really changes your body chemistry, and it helps you to manage your stress in a different way. This is the foundation of mindfulness practice. Now, we're going to move on to mindful eating. Now, does everybody have an article of something to eat with you? I hope you do, but if you don't, it's okay. Those of you who might not have a piece of food with you, it's okay. You can just do this in your imagination and try practicing it at another time when you do have food with you. So, mindful eating practice stems from what we just did, which, by the way, did turn out to be only 3 minutes. Mindful eating practice is paying attention to what we're eating, to how we are in our eating, okay? So I have to ask you again, as I did before, check in with your body. Notice, are you hungry? On a scale of 1 to 10, 1 being not hungry at all, 10 being ravenous, could eat the dog next to you. Notice how hungry you are. And notice where in your body you feel hunger. Okay? Just noticing. Checking in. Now ready yourself to have something to eat. But listen to my instructions carefully before you start eating. Take the piece of food or whatever you have there to eat. Take it in your hand and just have a look at it, knowing that you may never have seen this particular article of food before in your life. Just have a careful look at it. What is its size? I see your dog. What is the size? What is the shape? What is the texture? Just look at it and see if looking at a piece of food makes you feel more hungry. Sometimes it does, sometimes it doesn't. Okay, then next step is to take that piece of food and bring it to your nose and have a sniff. Does it have a smell? Dogs are great at doing that. I see that dog licking his chops. Sniff your food and see if that affects how hungry you feel. And now, what you've all been waiting for, take a piece, a small piece of whatever it is you have, just small enough so that you can just put it in your mouth for a few seconds and just leave it sitting there. So take a small piece of your food and put it in your mouth and relax with that and notice how it is to have a piece of food in your mouth and do nothing with it. Have you ever done that before? Just do nothing with it. Notice the taste. Notice the texture. Notice how much you're salivating with a piece of food in your mouth that you're doing nothing with. Just noticing. Okay, now you have permission to chew. But as you chew, please chew slowly and notice when you chew, how you chew. Did you ever notice how you move your jaws when you're chewing? Notice how you're chewing. Notice what your tongue does as you're eating. Have you ever done something like this? Have any of you ever had babies? You know what babies do? They are so sensuous. They just have to totally experience their food. It's all over their faces and their noses and their ears and between their fingers. You don't have to do that, but you can fully experience that piece of food that you're eating. Chew it thoroughly. When you're ready, if you haven't done so already, when you're ready, swallow it, and swallow it attentively, noticing what it feels like to swallow that piece of food, because you've never had that particular piece of food before. So that being said, if you'd like to continue eating, if you would like to have another bite or 2 bites of the food that you've got in front of you, go ahead and do it, but do it slowly, noticing the sensations and the changes in taste and flavor that happen when you're chewing. And noticing all along, as you're doing that, how your sense of hunger is changing. Are you becoming less hungry? More hungry? Do you want to gobble up the whole rest of the food that you've got with you, or go get another piece of it? Or are you satisfied with what you've got there? Just paying attention. This is a wonderful practice. If you're trying to manage your weight, this is a perfect complement to any diet you might be on, because you're less likely to overdo. You're less likely to eat too much if you are mindfully looking at, savoring, chewing attentively anything that you eat. In all the years I worked in hospitals, I will tell you, many, many, many people suffer from digestive disturbances, including reflux or GERD. I'm sure you've heard of people, if you don't already have it yourself, you've heard of people who have had reflux or GERD. One of the questions I always have to ask when I talk to people with digestive problems is, how quickly do they eat? How quickly do they eat? And I have to say, invariably, people will get a sheepish look on their face and say, I know I eat too fast. But I'll also tell you that when you do things like what we just did, it makes a difference. So is this Lisa saying that she doesn't eat quick, but she does have GERD? Well, I'm not saying that eating fast is the only cause of GERD, of course, but it can help. It can make a difference. And if you relax when you're eating, and if you chew carefully, your digestion is going to be better. So that's my point here. Okay, so does anybody have any questions, any thoughts about eating mindfully? How was that experience for you? Would you mind sharing a little bit about that? I think we can unmute you. We can unmute you if you'd like to say something. I'd love to hear how the experience was for you, whether you feel like this is something that you can take with you elsewhere in your lives. I'm looking to see if there's anything in the chats. So, yes, I think this is Lisa again, says it tastes better. Yes, you can taste your food. You definitely can eat more. You can taste it better if you eat more slowly. I'm not going to say you can eat more if you eat slowly. That's not true. But yeah, that's absolutely true. And there's so much to be said for really noticing what it is that's in the food that you're eating. There are some foods you may already have noticed in yourself. There are some foods that are going to tempt you to eat very fast. Have you noticed that? Sometimes people have problems with binge eating disorder. And they find that there are certain foods that can trigger them to eat too fast and too much all at once. So just notice what it is that you're eating, paying attention to the effect that the foods that you're eating are having on you. Yes, Barbara says, I like the idea of letting the food rest in my mouth. Yeah, I like doing that too. Let's see, and this must be Jessica. It's also a nice way to take a pause during the day. I'm always so busy, but slowing down at mealtime makes time to be calm. Oh, I'm glad you said that, because that's such a valuable thing. How many times do we all sit and eat while we're doing something else? Are we watching TV? Are we reading something? Are we on the computer? Are we looking at our phones? Are we on the telephone? You know what? It can all wait a couple of minutes. How long does it take to eat a meal? I'm not telling you to eat fast, but as she says, it's a nice way to take a pause during the day. When you're eating, just eat. I heard somebody say, I've never been to Europe, but I had heard somebody who had been to Europe said that in Europe, they don't have cup holders in their cars. Did you ever hear this? Because they say, when you're drinking, you should be paying attention to the drinking. When you're driving, you should be paying attention to the driving. So when you're eating or drinking, just drink, just eat, give it your undivided attention. You can really appreciate things in a different way. And it also helps you to be more relaxed. So Linda R says, I will definitely try this. Too many times I eat something and don't remember eating it. Boy, don't we all know that. You just wolf it down and you don't even remember that you ate it. And you don't even remember what it tasted like. Yes, Barbara says, Europeans just enjoy their food and drink. And why don't we? Are we so busy that we can't? We have the same numbers of hours in each day. If you tell me that you're too busy, I'm going to say to you, what are you so busy doing that you can't take 5 minutes, 10 minutes, a half hour out of your day to just take care of you? Because this is part of taking care of ourselves. It really is. If we take care of ourselves, then we're going to be healthy people. We're going to be less stressed people. And we can take care of ourselves and the people around us in a different way. So taking care of ourselves, stress management, and I know what I wanted to mention to you. If you want to say that you don't have time to take care of yourself, think about what they say on airplanes when they're giving you the instructions before the flight takes off. They always say, before you put on your oxygen mask, if you have somebody with you that you have to help, a small child, an elderly person, somebody that needs help, always put your mask on first, because you're of no help to anybody else if you're not if you're not well yourself. So put your mask on first before you go to help anybody else. So so that's what this is likened to. We're taking care of ourselves. So, any questions? Any thoughts? Any other thoughts? What is that bear doing in the picture? Is the bear eating eating food? So mindfulness practice is the foundation, as I said to you before, taking that time to breathe, taking that time to notice how we are, doing a mindful check-in. You can breathe, you can notice your thoughts, your physical sensations, your emotions. You can notice all these things, and you can apply it to all areas of your life. The topic of today's conversation is how we eat, but you can just as easily apply this to how we exercise. When you exercise, what are you doing? Are you listening to your body? I'm not an exercise expert, but I do exercise a lot myself. When we're exercising, are you paying attention to your body? Or are you following someone else's directions that may not know exactly how your body is? If we are mindful in our movement, even if it's just walking, knowing that not everybody walks the same way, not everybody moves the same way. We have to listen to our own bodies and respect ourselves. We need to treat ourselves compassionately. There's a lot of talk about that lately. So I'm really glad that you came. Barbara, I'm glad that you like this and you'll be able to use it. It's certainly easy to use, isn't it? Any questions about how to do it? Wasn't hard, was it? Okay. Well, on the final slide here is my contact information. If you'd like to get in touch with me by email, by text, or by telephone, I'll certainly be glad to talk with you. If you have a group that would like me to speak to it, I'd be glad to do that too. Mostly I do Zoom meetings, but I sometimes go to see people in person. So think about that, and we'll see what happens with the library. I'd love to do more here if there's an interest in it. So thank you very much. Thank you, Linda. Thank you, Lisa.